Hello, my name is George, and today I'm here with my patient. I'm going to cover the musculoskeletal system and the neurological system. So first, I'm going to check the vital signs like I usually do. Okay, 124/76. And the pulse is 62. Respirations were about 14. And the temperature. Okay. 98.2. Okay, so let's talk about your history.
Okay.
Have you had any problems with your musculoskeletal, meaning had any problems with any movement of your arms, of your legs? Have you had any problems?
No.
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 Have you had any sprains, like an ankle sprain or anything like that? Or?
No ankle sprains. No.
Okay. Neurological system, have you had any problems with your mental health?
No.
Memory loss?
No.
Confusion?
No.
Something like that? Okay.
None.
Okay. Okay. Well, we're just gonna get right into it. So what I'm gonna do right now is I'm gonna observe your gait, your balance, your posture, and your coordination. Okay.
Mm-hmm.
So first, just stand up. Okay. Sit back down. Okay. No problems there. Okay. Now stand up again, and right now, let me see if I can. Okay. So I'm gonna assess your back.
Mm-hmm.
So we're assessing the posture, the spine. We're looking for kyphosis, lordosis, scoliosis. Kyphosis. So if you can do me a favor, turn this way, and can you touch your toes? Okay. So
yes.
Just wait. Oh, let me. So I'm checking her spine. So kyphosis, I'm checking for the hump. No hump there. Scoliosis would be the curvature of the spine. Everything's fine there. And lordosis would be like the inward right here of the lumbar section. Okay, you can get back. So that's what we're checking now. Now your balance. Can you? I'm gonna just go stand like this and pick up one leg.
One leg.
Yes.
Okay.
Okay. Now put it down. I'm just holding up my arms just in case you fall. Now the other one. Okay. She's holding up her leg. No problem there?
No.
Alright. Alright. Now what I want you to do is to walk on your tippy toes from here to the restroom and back. So it's just... Okay, now walk back. Your tippy toes. Okay. Now do the same thing, only now on your heels.
Heels?
Yes, like that. Now back. Okay. Now the same. Now we're gonna do just. I'm just gonna go like this from toe to heel. Toe to heel.
Oh, okay.
And just go that way and just walk back. Okay.
the same way?
So this we're checking for balance right now. Okay, balance seems okay. Okay, now stay like that. And now twist for me to the left, or well, right, and then back.
This way?
Yeah,
That?
and then the other way to the right. We're checking the hips rotation. That seems fine. Okay, that's okay. Okay, all right, you can sit back. Okay, let's assess the temporal mandibular joint. So it would be this one right here. This would be your joint. Maybe check right here. Any pain?
No.
Okay, now move your jaw side to side.
Like that?
Yeah, any problem?
No.
Okay, now extend it.
Like that?
To the jaw. Like that. Okay. No problem there. Can you clench your teeth? Yeah. Okay. So we're just assessing the range of motion there. Okay. Now extend your arms like this. Like that. And now bring them back in. So we're checking the abduction and the adduction of the shoulders. Hyperextension of the arms. Okay, now can you move them all the way back like this? Hyperextension, no problem. Okay, can you do flexing? Flexion of the arms. Checking the shoulders. Now above your head like this. Now like this. And now touch your hands in the back. Okay, now we're just checking the range of motion, that's fine. Okay, now where it is the flexion of the elbows. Now extend them like this. Okay, now twist them. Okay, no problem there. Okay, we're just checking. You can put it back down. Elbow pronation and supination. Okay, pronation would be your palms down, and supination would be your palms facing up. Okay, so now we're gonna add resistance. So now I'm gonna go like this. So I'm gonna push in, and you're gonna push up. Okay? Resistance. Okay. Now I'm gonna pull, and you. Okay. Same thing. I'm gonna push forward. Okay. Now I'm gonna pull. Okay. All right. So we're just checking the resistance. Resistance is strength. 5 out of 5. Bilaterally. Okay. Now we're gonna do the wrists, hands, and fingers. So from everything that we're doing right now, I'm also doing the inspection, which is first. So we're checking the shoulders, we're checking any swelling or anything like that. As you can see, she's doing range of motion, so she, without no facial grimaces would indicate for pain. When I checked her back, I was also checking the scapulas also, and her back also for symmetry. Everything seems intact. Now we're going to check the wrists, hands, and fingers. So just let's put this back down. So put them out like that. Okay. So we're just checking nods, tenderness, swelling. No problem. Okay. What else? Okay. Now we're going to check your wrist. So go like this. Now go down. No, just your wrist. Just use your wrist. Go put them down. All the way. Okay. And put them up. Okay. Out. In. Eversion. Inversion. Okay. Okay. So now the same thing with your wrist. You're going to put up and I'm going to push them down. Resistance. So go up and I'm going to push them down. Pick it up. Resistance. Same. Pick it up. Okay. So 5 out of 5. Okay. Now spread your fingers. Okay. Now I'm going to apply resistance. Try to close them. Maintain them like this. I'm going to try to close them. Okay. I'm going to try to close them. Just maintain them like this. Okay. Make a fist. Adduction. That's adduction right there. Okay. Your fingers. Like this. Just your fingers. down, up, extension. Okay. Hyperextension would be up, flexion. Okay. The hips, we don't have a bed right now available to assess the hips, but we would assess the hips of the range of motion. I would place her supine, and then we would bend the knee for flexion towards her abdomen. Hyperextension, we would move the leg outward, and hip abduction, we would basically the scissors, and then the adduction with the legs, and then the hip external rotation also. So also the knees we would inspect. So right here I would basically be touching the patella. Right here, check for any pain. No problem. Okay. No pain, no tenderness?
No.
No. Okay. The ankles and the feet. Okay. So the ankles would be inspected sitting down, standing, and walking. She was already standing and she already walks. So right now she's sitting down, checking for any swelling, tenderness. We assess the dorsalis pedis and posterior tibial to assess that they're there. The dorsalis would basically be in the anterior portion of the foot, and then would be the posterior tibial would be in the lateral section of the leg or the ankle. We check finger and plantar areas. So let's see if we can do the dorsiflexion. Let me see if I can. Okay, there you go. There, okay. So dorsiflexion, you would flex up. Just the foot, just the ankle. Like that. Okay, the other one. Pick it up, and then flex it in, like that. Do the ankle. Okay, now leave it like that. And we would also do the plantar, which would be like this. Okay, now the other one. The plantar would be this way. Okay, and now pick this one up again. We're just gonna do the resistance. So I'm gonna push, and you're gonna push up on this one. Okay, ready?
Yes.
Okay. Go. Okay, that's fine. We'd also check the fingers, the toes of the feet. We would inspect them right here. We would check if they could, span out, anything like that. Okay, so now the neurological system, problems with that, there's a lot. So I'm just gonna name a few. Numbness, weakness, paralysis, generalized weakness, loss of motor control, dizziness or vertigo, tremors, seizures, confusion, or memory loss. So I already asked her about her history, if she had any mental issues or anything like that, dementia, Alzheimer's. We can even go as far as saying bipolar, schizophrenia. But right now we're just gonna check for the mental health. So first we're gonna do her status. So do you know what date it is today?
Yes.
What's the date?
May 21st, 2017. It's Tuesday.
You say May?
I did.
Let's try it again. What's the date?
Oh my God, I said May.
Why do you think it's May?
I don't know. November 21st, 2017.
Okay, what time
We're
is
on
it?
a Tuesday. It's, my God, 7:21.
Okay, and now so we're checking for date, time. Yeah, place, where are you right now? Don't say the address, just say just say where you are.
In my house.
Your house, okay. And what is your full name?
Julia
Okay.
de la Garza.
Okay. So alert, oriented times 3. Well, I could say disoriented times 1, which was the date. Like, I can't believe she missed that one. But all right. So then we're gonna check for memory loss. So I'm gonna say 3 words, and I'm gonna ask you to repeat it. But I'm gonna tell you these 3 words. I'm gonna keep on going to other tests, and then I'm gonna go back. Okay. So I'm gonna say blue, red, orange. So just repeat that.
Blue, red, orange.
Okay, remember those because I'm gonna ask you after we do a couple of these tests. Okay, so to check for mental health, we also have cranial nerve. We have 12 cranial nerves. We don't really have time to assess all of them, but I'll go through some of them. So, cranial nerves, the first one will be olfactory smell. So basically, and actually, like all these tests that I'm about to do would be with our eyes closed. So right now, what I would do is close your eyes, okay, and she would like tap it in one nostril, close one nostril like this, and then I would basically do like a little with like maybe like a cotton, and then dip it into vanilla or something. Right now, let me let me get something real quick. Okay, keep your eyes closed.
Mm-hmm.
Okay, I found something. Okay. Okay, so I'm just gonna place it up against, and you smell it and tell me what it is.
Chocolate.
Chocolate. All right. All right, that's it. So we're just checking like the sensory and stuff like that. All right, so the next one would be the cranial nerve 2, which was the optic, the visual acuity. For central vision, we would provide the standard chart. I covered that when we did the eye system, so we already covered that. The visual fields, things like that. Cranial nerve 3, oculomotor, and 4, abducens, which is the pupillary response and accommodation. I covered that also in the eye system, but it's not a big deal. We can do it again. So basically, we're just checking for constriction and dilation. So just look at the light. Well, look forward. Sorry. Just look forward. Okay, constriction. Constriction. Okay. And then just look at the pen. And accommodation. So those were already assessed, cranial nerves 3 and 4. The 5 will be trigeminal. So we can ask the patient to clench their teeth. So go ahead and clench your teeth. Okay. All right. Okay, so we can also do the sensory nerve 5 sensory function. We can do sharp and dull. It's pretty. No, this is dull. It's because the first thing that I got. Let me see. What can I use? Well, I guess this is a little bit sharp. We'll use a pen. And so basically just close your eyes. And I'm going to place the object up against wherever I place it. And then you're going to tell me where I'm placing it. And if you feel sharp or dull. We'll just go with, just this. This is sharp. And then this is dull. Okay?
Mm-hmm.
Okay. All right, so ready?
Sharp.
Where?
Forehead.
Okay.
Sharp from the chin.
Okay.
Dull on the cheek.
Okay.
Dull on the nose. Sharp on this other cheek.
Which side of the cheek?
The right.
Okay. Okay, that's it. So that was basically checking cranial 5. Okay, so the other one would be motor or cerebellar system. So this one, you can just stand up for me, please. And eyes closed. Close your eyes. Okay. So let's see. All right. So right there, we're already doing the Ronberg test, checking for functional equilibrium. As you see, her feet are next to each other, so that's another thing we need to. Her feet are next to each other. Her eyes are closed, and basically, if she would be moving from side to side or anything. She's losing her balance, so she would, that would be abnormal. All right. So another thing we can do is extend your arms like that. Yeah, like that. All right. This is pronator drift with your palms up. Yeah, like that. You can't see. Okay. Can you bring it down a little bit? All right, like that. So, all right. So what I would be doing is just resistance again, with your eyes closed. Okay. So there we're already assessing for pronator drift. Let's go. You can bring it down. Mm-hmm. All right. Okay, sit back down. Okay, so this is the cerebellar function coordination. Okay, so what I'm gonna do is I'm gonna go like this, and you're gonna
follow.
How does it go? Yeah. So you're gonna place your index finger like this.
Me?
Yeah, you're gonna touch mine.
Oh.
And you're gonna follow it wherever I go. So just touch it. Keep touching it. Touch it, and then untouch it. And then untouch it. Okay. Okay, so she's following me. All right, so this is the one I was trying to look for, the sensory system to temperature sensation. So we would close your eyes, and then I would place cold, and you would tell me, oh, cold or hot. But we really couldn't find something that we could, other than eyes, but we couldn't. So we're gonna have to skip that. We can do the stereognosis. Okay, so close your eyes. What I'm going to do is I'm going to place an object in your hand, and you're going to tell me what it is, basically. Mm-hmm. And this is what we're testing for, stereognosis. Mm-hmm. So close your eyes. Mm-hmm. Okay, there. Now feel it.
Pen.
Okay, so it's a pen. Okay, pen. And play. Okay, now the 2-point discrimination. I brought up, they used a paper clip. So I'm gonna use it too. So just keep it. So what I'm gonna do is I'm gonna just poke you, and you tell me if it's 2 points or 1 point. Okay, so close your eyes.
That's 1 point. 1 point. 1. 1.
Yeah.
It's because I don't know if it's like 2 or 1 that you want me. What is the difference between that feeling? But I feel only 1.
Really?
Yeah.
Because I'm literally like going like this and then poking you like that.
It's because it feels only like 1 pinch.
Yeah.
Yeah.
All right.
Like that's the whole clip, right? That you're putting on me?
Look at the clip. You see? So like I'm trying to do this and then poke you like that.
That feels like 1.
Okay, never mind. You get the point though. All right, that's and then the graphesthesias. So I'll just hold out your palm and then close your eyes. Mm-hmm. And basically I'm just gonna like write something and you tell me what it is.
It's just like a wave, like an
okay,
E.
Let's do this again. What number is this?
1.
Okay, that's what I meant.
Okay.
What number?
2.
Number.
3.
Okay, so yeah, that's what it is.
Okay.
And the last one, but not least, would be the reflexes. I don't have the object for it, but we would test the biceps here, and then it would be the involuntary movement, and then the triceps, and then she would probably jerk, and then the plantar here, and then the foot should be going up. So that would be the reflexes, and though that's all to basically assess the neurological system. Mm-hmm. Oh, forgot. Now we have to go back. So do you remember those 3 words I told you earlier?
Blue, red, orange.
Yes. Blue, red, orange. And there you go. No memory loss, thank God. All right. Well, thank you. And that's it.
Except for the date.